Hello, I'm Natalia and I'm a specialist pelvic health physiotherapist. In this video, I am going to explain to you how to use your pelvic floor exercises to help with different things. The first exercise that I'm going to explain is to help with your overactive bladder if you're suffering with symptoms of urgency or frequency. For this exercise, I want you to remember how to do your quick pelvic floor exercises. If you don't remember, please go back to the introduction to pelvic floor exercises and then you'll remind yourself how to do the quick ones. Okay, so let's imagine that you go to the toilet 10 or 12 times a day, and sometimes during the night you could also go, 3 times a day. These exercises are going to really help. So the first time that you get an urge to go to the toilet is possibly when you wake up. At that point, I would really like you to go to the toilet normally, but then as soon as you get the next urge to go, I would like you to stop yourself, don't rush, and just relax and do 10 quick pelvic floor exercises. Remember, closing the doors, bringing the lift up, dropping the lift, and opening the doors. And I would like you to do 10 of those. What I'm hoping that does is that it's going to get rid of that urge to go to the toilet. And it's going to buy you time until the next time that you feel the need to go. So the next time that you feel the need to go, you're going to go again as normal. And then the next time, you're going to again do 10 quick pelvic floor exercises. What I mean by that is that every other time that you get the urge to go to the toilet, you're going to try and practice 10 quick pelvic floor exercises. So then your bladder calms down and you get more time in between the trips to the toilet. Those exercises should help with letting your bladder hold a little bit more each time. But it's very important that when we're doing these exercises, we're also hydrating ourselves properly. So I would like to really keep in mind that when you're not drinking enough water or when you're not drinking enough of the good fluids, and that is water or herbal teas that are not caffeinated, your bladder can also become really irritated. So by increasing the amount of water that you drink, and ideally up to 2 liters of water a day, that on its own can really help with how irritated your bladder feels. The other thing that I want you to keep in mind is reducing the irritating drinks that you are taking. Perhaps you're drinking far too many cups of tea a day, far too many cups of coffee a day, and that can really irritate your bladder. So I will ask you to limit those drinks to maybe 2 a day and keep them in the morning, because caffeine builds up in your system and it can take up to 9 hours to really go out of your system. So that is the routine that I would like you to practice if you're struggling with an overactive bladder. Now, I am going to explain exercises that I would like you to practice if you're struggling with stress incontinence. That is leaking when you cough, leaking when you lift heavy weights, or leaking when you lift your child or your grandchild or even the shopping. This can also happen if you exercise at the gym and you find yourself leaking at that point. So now I'm going to demonstrate a pelvic floor exercise with squatting. So get in position, stand up with your back straight but not rigid, and then try to go down into the squat with a relaxed pelvic floor. So that's with the doors completely open. You're going to breathe in as you go down. And at that point, you're going to close the doors. You're going to breathe out as you go up. And then you're going to open the doors. Let's just try that again. You're going to breathe in and go down with your doors and the pelvic floor relaxed, and as you go up, you're going to close the doors and breathe out. What I'd like you to do is practice that exercise 10 times, and then you're going to practice the next one that I'm going to demonstrate, which is a bridge. So lie down on the floor or on the bed with your knees bent. You're going to take a deep breath in and you're going to go up with your pelvis as you blow and as you close the doors. You're going to hold the doors closed for 3, 2, 1. Breathe in again. Completely let go. And again, let's do it once again. You take a deep breath in, completely relax the pelvic floor, let the doors open, and as you blow, you're going to close the doors and keep them closed for 3, 2, 1. Breathe in and relax. So, what I would like you to do is practice the bridge exercise 10 times a day as well as the squat. And I would like you to perhaps replace some of the other exercises that we explained in the introduction to pelvic floor exercises for these ones, because these are going to be more useful when those muscles are a little bit stronger, but when you're going around your day, for when you're going to the gym, when you're running to the bus, or when you're lifting heavy things. I would like you to continue with the other exercises that I've explained in the introduction to pelvic floor exercises. Those are the ones with the coughing as well as the breathing exercise. So we need to make sure that the pelvic floor relaxes as well as it gets stronger. So that is all for now. I will see you next time. Thank you.